This is board-certified veterinary dentist Joe Banyard, and in this video, we will talk about home care instructions for owners whose pets have had oral surgery. This includes extractions, fracture repairs, orthodontics, or removal of oral masses. After these big surgeries, the surgery site needs to be protected so that the gums and underlying bone can heal. Bear in mind that the suture material we use is very fine and can break easily. Also, above all, we are working with animals. They don't think like people. So, as their guardian, the pet owner takes the responsibility to look after them and help them avoid doing things that may damage the oral treatments. So, after oral surgery, your pet needs to take his or her pain medications as prescribed. And the pain medications are super important. If you have any concerns, do arrange for a recheck with the surgeon or with your regular veterinarian. Make sure that your pet wears the Elizabethan collar, also known as a buster collar or the cone of shame. These are also very, very important as they prevent your pet from scratching the face and chewing on things. You need to plan ahead. Take away all toys. Do everything you can to prevent scratching. So, flea medications are needed in flea infested areas. Pets will groom other pets. You must prevent this, and maybe you need to separate them until the healing has completed. Anytime the cone is taken off, it must go back on when you cannot watch the pet. Do not take your eyes off your pet when it is off. It just takes a second for your pet to damage the site. This is very important as pets will want to play with their toys, lick themselves, chew on things that will destroy the suture material, and the sites will break down. And it will also make more work for you and more discomfort for a longer period of time for your pet. Some pets are able to take cones off, so you need to contact your vet about this. Some pets need a different device or an additional device, like a basket muzzle. These are very helpful. After surgery, your pet can only eat very mushy food. It has to be the consistency of yogurt, no lumps in it, okay? So, cooked rice, baked chicken, mashed foods, these are not soft enough. They'll break down the sutures. So, to make mushy food, you can add boiling water to the kibble and let it soften and cool. This takes a few hours, so plan ahead. It still won't be soft enough, so do blend it. Don't miss this step. A handheld blender, magic bullet, or standard blender are all good ways of doing this. Your pet must have no access to hard foods such as kibble or hard toys like kongs, antlers, rocks, or wood. These will break down sutures, as will chewing on stuffies and blankets. Any fluff that your pet chews on will get tangled in the sutures and will get covered with plaque, which is bacteria, and the surgery sites will fester. So think of hair or fluff from stuffies. So let's not go there, okay? If a pet self grooms, the hair will get trapped into the sutures and cause festering like fluff does. Please do not look inside the mouth, as the tension you put on the lips when you open the mouth will destroy the closure. Only the vet should do this. Arrange for appointments to take your pet back to see the surgeon in 3 and 10 days. The 3-day recheck helps catch problems early, and if any tweaking of the home care is needed or if there are misunderstandings, these can be corrected. The 10-day recheck is to make sure all is healed and sutures can be taken out, and to make sure the mouth is well healed before feeding kibble. And although the sutures are absorbable, they take a very long time to do this, so it's good to remove the sutures. Some pets need sedation for the suture removal, so do be prepared for this. In some cases, the surgeon will find that the sites have healed, and with just eating dry kibble, the weakened sutures will just pull out. Well, I hope this helps you. I have other variations of this video coming up for those of you who are interested. Well, thank you for watching, and please subscribe, like, and share. Goodbye.